Welcome to the Movement PT Coffee Cast, where we sit down and talk about physical therapy, health, and whatever else comes to mind during our coffee-infused conversations. What's going on, guys? Welcome back to the Movement PT Coffee Cast. My name's Dalton, and with me, as always, is my beautifully bearded friend, William. William, how are we doing today?
Doing really good, Dalton.
Oh, yeah? That's great.
Yeah. No. We finished our exam last weekend. As people, might know if they've been listening to the last few episodes. So it feels really good to just kind of be able to do whatever I want on the weekend.
Yeah, you're a free man.
And we're doing that right now.
What else would you rather be doing than sitting down, drinking coffee, and talking about physio?
Pretty much nothing.
And then to make it even better, our guest today is unreal. So we're just going to introduce her right away. So today on the podcast, guys, we're talking to Steph Allen, who is a physical therapist in Boston, out of Boston PT and Wellness. So Steph, welcome to the show.
Thank you, guys. You're making me blush over here.
Yes, you should be blushing. You're killing it. We're pumped to talk to you. Finally, it's been a long time coming.
I know. I feel like I didn't realize that it took that long because we talk every so often anyway. So
yeah,
kind of I don't know, to do it formally in a podcast is kind of cool.
Yeah, I'm pumped. Why don't you just kind of start off, for those who don't know you, just give a little bit of background of who you are and what you got going on in Boston.
Sure. I graduated from Ithaca College in 2013, the DPT program. I stuck around Ithaca and did an ortho residency, and then still, which I don't know, maybe we'll get into a little bit on this podcast, but I still wasn't quite sure where I fit into PT or about where I was going to go. So I did travel PT for a couple years, hopped around California, New Mexico, Colorado, New York, and was a little bit, I think the best word I can use to describe it was a little disenchanted with general outpatient PT and was really looking for something different and better and with a ton of room for growth, both for myself and for the profession. So fast forward, I stayed friends with Zach Gabor from college, and he and our old coworker, Matt, I had stayed in touch with them and visited Boston PT Wellness a couple of times. And with ongoing experiences, I was just like, I want to be here. It was this if I can pick one place, I want to be here. So I had a couple of interviews as far as quote unquote plan Bs, but I was pretty much planning on, even if I didn't start working at Boston PT and Wellness when I was done with the travel, I was going to take another job in Boston and legit just wait until Dave, our boss, had an opening expanded, and then was just going to try and, do an epic move in. But I lucked out, and Dave wanted to try and hire another female at the time, another full-time PT, because they had two male therapists, one female. And so I started out part-time, and I was like, I don't even care what it is, how much you're paying me, So it was a little rough financially the first year, but I don't regret it at all. And now we just opened up our second location in a town, Winchester, close to the original spot, and we're busy as heck. And I can't complain about a damn thing.
I want to talk a little bit about that experience, like going through the travel PT, and I think what people need to maybe understand if they're going through the same thing is that you can search out and find a place that aligns with you and that you're passionate about. So maybe kind of take us through that transition period and some of the things that you went through in order to finally find that dream job at Boston PT and Wellness.
Yeah, absolutely. I was super, I didn't plan it very well. I didn't really know that it was an option. I thought that it was pretty much a nursing thing, like travel nursing. That's the only thing that I had heard of. It got mentioned to me by another one of my classmates who was already doing it for that first year after we graduated. And I thought to myself, you know what, I have pretty much never done anything spontaneous in my life and didn't really get to travel during PT school. We kind of had one semester where we had mostly finishing up prereqs or whatever where we could have traveled, and I just couldn't afford it at the time. So I was like, okay, this could be cool. What I didn't know at the time was, one, that it was fairly normal to work with more than one travel company. So those of you who are considering it, you're not being, disloyal or anything to the first company that you're with. It's actually fairly normal to work with more than one company, because some of those companies will have affiliations or partnerships with either hospitals in locations that you want to be in, or maybe they have more options as far as setting, that kind of thing. And you can pretty much, once you go through the formalities of paperwork and stuff as far as becoming a PT or contractor, they call you, for each company, then you can kind of opt to work with one versus another, and you don't necessarily have to stop working with the other one. You just kind of take a hiatus and don't take their assignment for that 3 months. So that was something that I wish I had known, just because I feel like there were some options that were a little bit limited to me. I definitely from the get-go cared about what setting I was in. I wanted to stay an outpatient. And then what I had found later on was the other things that's potentially get compromised with staying in one setting is geographic region. Sometimes I had to be a little flexible there, as well as type of setting, in the sense of most of the time for them to be flexible enough with me staying an outpatient, I had to be hospital-based outpatient. So it technically wasn't really the outpatient ortho younger active population that I was looking for. And again, that is not a bad thing. We need those. I think that hospital-based, very Medicare guideline centric, and not so much room for growth or motivation of the people around me to kind of do better, learn more, that kind of thing. So I started to just feel really stagnant. And again, that was just me. Sometimes, like if you're traveling with somebody else, which I probably in hindsight would have done, a friend or significant other, either or, that oftentimes I think adds to the experience in a positive way. But that was more so like, I saw a lot of cool things. I spent a lot of time with myself and learned a lot about myself. But also, I think the two biggest things were I realized what I do want for a permanent setting, and a lot of things I was damn sure I did not want. And so for that, I don't regret the experience at all.
Cool. That really leads into something I've been dying to kind of ask you about and talk to you about, because you kind of mentioned, you went through all that and then you got to Boston PT and wellness and you kind of never looked back. And I know from talking to Dalton about his experience with you guys, he's constantly raving about the culture at that clinic. And so I'm curious, like when you got to Boston PT and wellness, what was it that made you know that's where you had to be? And how is that culture developed over the last couple of years?
That might be my favorite question that anyone's ever asked me. Thank you, Will.
Woo!
PTs. And it's easy because when you walk in there, people are just freaking happy to be there. Nobody, there's always exceptions. There's the occasional exception, but for the most part, anybody who walks into our clinic, either clinic, and that's something that we've been super kind of strict with ourselves and whoever we bring on, is that nobody that walks in, we want them to think about like, okay, why are they like, whatever their ailment is or whatever they think it is type thing. Like that is not the first thing that we want them to think about. Anybody who walks in, they get asked, and not patients either, like anybody who's with a patient, family members, those kinds of things. Like say, hey, how are you? How was your weekend? How was, your son's soccer game, whatever it was. And it was something that like hit me hard when I walked in, because I wasn't a patient. I was a friend of somebody working there, but I still didn't know anybody. The setup is such that it's open where you're kind of invited to sort of just walk in. And it's, for lack of better words, it's really just a good vibe. And I think what I've noticed since working there, at first it was just like, this is a really cool place to be. I just want to be here. And the clinicians that already worked there, I knew what caliber they were, and they were always kind of bouncing ideas off of each other and kind of, not ever in front of people, but calling each other on their shit and like asking you why you're doing those things. Like I wanted to be in a place where I thought that I was the dumbest one there. So from a clinical standpoint, check that box off. From a literally just fun place to be, I could check that off. From what I'd heard from Zach and my experiences with Dave, our boss, at this point, I didn't realize him, but he ended up almost being like a father to me the first year that I was here. So who you're working for, not just the company, but the person, I would freaking lay on train tracks for that guy. So I don't know how many other positive boxes you could check off as far as working for somebody other than yourself. But I felt like I kind of hit the jackpot. But if I were to pick one thing, it would be literally when you walk in that place, you're just kind of, you want to hang out.
Yeah, for sure. I can attest to that a little bit too. Is like, it's hard to put words on it, but it's just like when you do go in there, it's just a different feeling. And I think it's the vibe that is created by everyone in that place. Like all the physios, even like your front desk staff, like everyone that's there, they're all a part of it. And the one thing I did notice a lot was like, you can see that instant change on a person when they walk in the door, when they walk into that environment. Cause I've seen people walk into different environments, and then I've seen people walk into an environment like what you guys have at Boston PT and Wellness, and the change in their mentality is huge. And I think if you can get that right away, or at least start to influence that off the bat, like you're already heading in a right direction before you even sit down and have one or two words to that person. And I think that's huge.
Well, I think that's what, you just said it in a sense that what we're learning more and more about as far as pain experiences, and some of the psychosocial things that go into not even necessarily pain, but just maybe an injury state or whatever it is, some sort of decrement in functions, whatever reason that they're seeking you out. The more that we're learning about how much other things go into it besides what's going on in your tissues, like if you can at least, again, if we're checking off boxes, or if you can at least be confident that the one part of that equation as far as the confidence support system and general setting of expectations is already kind of off the table in a positive way, then I think as far as setting people up for success, that you're in a little bit better out of the starting block type thing.
For sure. Yeah. The other thing that I really loved about what was going on with Boston PT Wellness is the fact that like each of you guys are kind of building your own brand or going down your own area of within physical therapy. So for example, like you're doing like the ACL, and I know Mike Amato's into whatever he's into, but he's always talking about crazy stuff. And then, Zach doing his thing. I just always felt like there's people trying to get better from all directions. And then you guys were able to bring it together and share it with each other. Like, is that something that's purposefully done and created by like Dave, or is that just something you guys naturally went along and did yourselves? Or
I'll be honest, I think that what Dave really did as far as orchestrating what's happening, what you just described, was simply bringing on the right people. So what you just described, it kind of has organically happened amongst us as far as the actual PTs and our personalities, and the fact that we are basically like a family and friends in general. So when we are nerding out together, which is pretty much all the time. These ideas come up. We're not like huge fans of the whole work-life balance thing. Maybe in like 10 or 20 years or something like that. But for right now, it's what we do. And so the kind of detail end of it, or the logistics part and how it's actually playing out is kind of us. But, you know, Dave had on Danielle, who now is killing it up in Portland. Yes,
Danielle's a beast.
Yeah. And, she built a huge base as far as representation and relationships with the endurance community here. She's a phenomenal PT and performance and running coach. She was the first one on. So think about it. Like, this badass was your first PT. And it was just her and Dave for a little while. And then after Zach had reached out to Matt, who was the strength coach at the time, he was brought on mostly through Matt, but, had reached out to Danielle before he even started, and they developed a relationship. So the two of them kind of began really the whole, vibing with each other and getting to know each other's patients. That kind of precedent, I think, was already set, and the fact that everybody was already a family, even though it was small. And then each person that was brought on was, every person we've hired has been a team decision. Has been like, Dave will purposefully brings them, and he doesn't really interview people. He'll talk to them for a few minutes, but then he'll literally say, like, go. He literally shoves you out on the floor with us, and kind of sees how you interact. And so by the time I came on, it was Zach, Sean, Danielle, and Dave treating. And yes, I'm sure it was a little bit of an advantage having known Zach and Matt already, but everybody who we brought on has been somebody who has kind of fit well into our interactions, and being able to, like, hey, can you grab my friend Mary that thing and show her really quick, and like everybody knows everybody's patients, and if that's something that somebody was awkward with, we didn't hire them. And not that they were a bad PT or anything like that, but it just wouldn't have fit. It wouldn't have been a culture fit, like you said. So I think specifically what Dave has done is, and I'm not sure if he noticed or purposefully did it, but basically made quality control easier for himself because of who he brought on. And then anybody subsequently, he didn't just hire on his own. Like, he would ask all of us what we thought, and watched whoever it was interact with us too, and the patients. And not only do I feel like it kind of makes his job a little easier, but it's smart as hell if you think about it.
It is smart. Yeah.
It's better for everybody around, when you have that open communication, because especially being a new grad, you have so many questions. You're never really that confident with most of your directions that you're going. You hope that you're obviously trying to arrive at something that makes sense, but having the ability to kind of like collaborate with people and ask questions and brainstorm constantly, like that's what's going to make you grow and get better and more confident in the future.
And not only us, like we get to reap the benefits of constantly challenging ourselves on a regular basis, but the patients benefit from us challenging each other. And to me at the end of the day, like, call me crazy, and I'm sure there's probably other people that can relate to this, even though it sounds a little crazy, but I mean, like, there's things that we'll talk about, and I will specifically think like, oh, that would work with so-and-so, or I really want to try that with so-and-so, or we like have dreams about patient situations, and you know what I mean? Like, we take it home with us in a good way, and yes, it's fun, and yes, it helps us grow, and that's, from a professional development standpoint, awesome. But my brain always comes back to the humans that we work with, because if I get just a little better, or I suck a little less every day, like, then they benefit.
That's awesome. Something I wanted to bring up. So like, obviously you're a big part of Level Up Initiative and the growth mindset. I know one thing that we've talked about before with you is the fact that like putting yourself out there on social media, or even doing podcasts, or putting yourself out there in the Physio Night Out presentation, like these are all things that you're not naturally comfortable with. So maybe take us through a little bit of like how that process went for you in terms of like facing that discomfort, and how you managed to do that.
I do have to give some credit to Zach. I know. Damn it. No, I mean, we were friends for a really long time before we started dating, and both, even from afar, you know, we consulted with each other on certain things. And once I moved here, and particularly once we started dating, like, he kind of got a little bit more of a taste of some of my own issues with confidence, really. I think part of it, you know, it's a whole different conversation, but part of it being a female in kind of the ortho and fitness world is tough. Sometimes more so we make it tough for ourselves, I think. And, you know, that's partially society, I think. So he really from the get-go kind of pushed me to start doing some things. And I also think that I was at a point where I have, you know, with ACL stuff particularly, but in general, with the way that general PT is, or general outpatient PT, and especially for the return to sport aspect of things, it was getting to a point where I was getting so frustrated with things as they are, and seeing injury rates and re-injury rates, and getting a lot of kids and young adults that had really poor experiences. So it was more of a part inside myself too, where I was like, you know what, if this really gets to me so much, I need to start doing shit about it, because I can read research, I can educate my own patients, but I wanted to do something more than who I saw in the clinic every day. I wanted to figure out how to reach more people. I know that I write a lot better than I speak, and as far as being comfortable and everything like that, but I knew that, you know, you can only get so far with that as well. So kind of just threw myself in the deep end, did a few podcasts. After that, it definitely felt better. I think my first one ever was the movement docs. Shout out to Jake and Mike.
Shout out.
But yeah, and I mean, shit, if I think about it now, I've presented 3 or 4 times. I'm doing another, I'm doing a like Skype talk for St. Augustine that on Tuesday, that came out of being a mentor during Level Up. One of my mentees reached out. I get questions on a fairly regular basis, and it makes me happy. It was one of those things where you literally just have to do it. You have to be okay with maybe yourself feeling super awkward, or misspeaking, or whatever it is. I think we're so afraid of being wrong or sounding like an idiot. And I think that Zach, the book Mindset, and a little bit of my own frustrations and kind of just intrinsic motivation were probably the perfect storm for me to actually start doing stuff. But yeah, I mean, you need to at least be open to adopting a growth mindset before you can do that stuff, or else you're probably just going to be a nervous wreck the whole time.
Speaking of all that though, you ended up, you know, coming and doing the Physio Night Out.
Oh God, yeah. That was a little scary.
Yeah, I mean, like, it's crazy though, because you guys have connected to so many people through social media. And so I wondered, you know, that experience must have been mind-blowing. You know, what was it like seeing everybody in that room and just kind of knowing the impact that you're having through social media?
Man, you're making me get the sweats thinking about it. You know what? I think you just said it really. What I kept thinking was like, this legitimately would not have happened without social media. And I know we get frustrated a lot on a fairly regular basis as far as some of the shit that's out there, but it also can be used for such good. So I think that the more of us that are noticing that and pursuing that aspect of it, I remain hopeful in that sense that it'll continue to. But yes, I think that was what kind of kept going through my mind. Well, was like, these people are here mostly because, they wouldn't have known who I was. They wouldn't know who Zach was. It was partially Nick Hanna because originally he was going to do a talk. And then I kind of just got the opportunity to take his place because he was working on some other things. But it was really awesome. And I had some people, we had some good conversations after the talk, and people really expressed gratitude. And it's something that makes all of that kind of nervousness and worry and, oh, well, I'm not really good at speaking in front of people. I'm soft-spoken. Nobody can hear me. Everybody makes fun of me for that. Like, I'm a girl, and all of those things that had been floating in my mind for, gosh, freaking years, standing up there in front of those people and then having, some people come up to me afterwards and even in the weeks following, and expressing gratitude and asking follow-up questions and fueling my fire kind of thing. It made all those ruminations kind of worth it. So that would be my other thing too, is like, especially females, if you're contemplating doing something, like if something grinds your gears enough that you really want to do something about it, you would be surprised how accepting people, men, kids, social media, you would be surprised if what you're adding, if what you're bringing to the table is genuine and you're just literally trying to add value. You don't have to sound perfect. Just do it.
Yeah. I think that's a huge message for people, and I can speak from being there. I know that was probably really intimidating and, like you said, nerve-wracking, but the way you handled those questions with so much poise and challenging questions, questions I would not be able to answer, and so it would have been a shame if you never went and did that, So I hope that, and I know that experience is going to reach out to some people that hopefully will take that leap, going forward.
Well, I appreciate the poised comment because, you also forget, well, I'm almost 30. So there's some situations where like, maybe my 23 or 24-year-old self would have felt like I was getting come at by somebody. And though I don't necessarily remember killing any questions, I just kind of, you get a little bit more comfortable with viewing those things as part of a conversation versus like, oh my God, I have to cite a study or whatever it was. So, but thank you. I appreciate that.
Yeah, and I think it's interesting because a lot comes from those things. Like for myself personally, from that experience, and me and Will talked about this after, was like obviously doing our social media thing and having like relationships with you and Zach, seeing you guys go up there and absolutely crush it and answer those questions and deliver the way that you delivered, honestly humbled me and being like, okay, you still got some work to do here if this is what you want to do. And like those are things that I think me and Will want to do in the future. But to like watch you guys execute it was like just gave us a little bit of a reminder that okay, like you guys still have some work to do and that's okay, but you can get to that position. It's just going to take a little bit of time, probably a lot more discomfort.
Well, I myself probably more so, but we have a very far road to get better as well. So it's humbling to hear you say that. And you guys, just a quick aside too. I mean, I don't know, you guys are already, reaching a lot of people. I think through social media and the podcast, it's slightly different than doing things in person. I think that's definitely a way that you guys can step it up or create another branch of what you're already doing. But don't discount what you're doing, what you've already done, because it deserves a pat on the back too.
Appreciate it. There you go. Will pats himself on the back.
I was hoping maybe one of you would do
it. Let's dive into the Level Up initiative, since we're talking so much about growth mindset. I'm curious to hear your take on, now that it's wrapping up basically the first cohort, how has it gone from your perspective in terms of when you guys started?
Talk about being humbled. The amount of passion, intrinsic motivation, open-mindedness, and just kind of determination to do better and actually be a part of making a positive shift in such young individuals is so promising. And being a mentor has been awesome, because some of the conversations and questions that have been posed, and in my group in particular, I know I can speak for mine and several of other groups based on what the mentors have said, but each member is a part of like a small family within Level Up now. Like we each create a Facebook group to stay in contact with each other, especially if there's different time zones or anything. And these students and new grads have been posing questions, and fairly almost little mini like existential crises going on, especially as they're transitioning into clinical and into actual practice. And just seeing some of the other students, I had students kind of swoop in and give their advice and their experience and raise other questions and even challenge each other. You kind of just sit back as a mentor and you're like, damn, like these are the types of conversations that need to be had without people feeling as though they're getting judged, or if it's bad to be wrong, or all those kinds of things. And that's why I think that, module 1 at the get-go of the Level Up is growth mindset. And it sets the expectation, it sets the precedent that everything going forward from here, it welcomes failure and challenge, and nobody is being judged. And this is all for something better. So I think that as far as for me as a mentor, I learned a lot about myself, in the sense that being able to help curate conversation without stepping in too often is hard. And I think that we do that as PTs, especially in like a subjective or an eval. And we talked about that in our groups too. So I think that was the one major thing that I learned about myself, but also, I'm just so damn hopeful and encouraged after this first round. Because like I said, we see a lot of crap on social media. We get a lot of kind of not great stories from patients when they come in, and it's really easy, if you get a lot of it in a week, to feel super discouraged. But you know what? This is really making me realize that we are making a difference. It might take a while, but we are, and more so you guys, the students and the new grads. So that makes me super happy.
That's awesome.
Yeah, the one thing sorry, Will, go ahead.
I was just going to ask, like you mentioned the kind of existential crisis that a lot of students and new grads are going through with that transition. I mean, Dalton and I haven't experienced any of that.
Yeah, of course not.
But I'm just wondering, what seems to be contributing to that, from your experiences talking to people?
Yeah.
What do you think is kind of influencing those types of feelings?
Unfortunately, I think it's just that there's a lot of people that have kind of the opposite of a growth mindset, and they've been practicing, even if it's only, 5-10 years. These newer grads, younger clinicians are coming up and kind of, either asking some questions about things that these clinicians don't want to address, or that maybe they don't know a lot about, or they don't believe in, and or questions and ways of doing things that are not in line with how they've learned to practice and how they've been practicing for a really long time. So to their credit, these older clinicians they're really getting something that they believe deep down challenged, and that can create such a, if you're not open to new things, like that is a really, I'm not sure the right word, but like a not good experience, a very like, these people, we've talked about the backfire effect before, like it can make them hold on tighter to what they believe, even when you present them with evidence against it. So I think it's a mix of that type of mindset still predominating a little bit in the clinical arena. And then also these students, new grads, feeling as though they're in a spot where they can't speak up or override this that's already there. And that's a really, really hard spot to be in. And so we've talked a lot about trying to navigate that with either clinical instructors or new grads that are out, and their kind of informal mentor is, really brushing aside any talks about psychosocial or the very beginning inklings of pain science or predictive processing or anything like that. And again, nobody has to be an expert, but it's just, to start those conversations, which are the conversations that need to be had, that's a huge barrier to entry. So that's what I was referring to as far as some of these little existential crises that the students were having. And it's really tough to navigate.
I think you hit the nail on the head,
Yeah, 100%.
because that's like the reason why I kind of I had made a podcast about trying to navigate that sort of situation, because if I'm being honest, that's exactly how I felt at, I'm not going to say all my placements, like some of them, but most of the outpatient placements, I felt like I wasn't able to question things, and I was kind of looked down upon for having a certain approach, that was mostly exercise based and trying to learn about pain science and education and communication. And it was really hard not being able to kind of question things or even discuss like some of those things that you just mentioned.
Yeah.
And I think that's why the Level Up initiative is so key for the growth of our profession, especially new grads. Because I think, like you said, sometimes you don't feel comfortable speaking up in those situations. And I think what the Level Up has allowed is for people to let those barriers down and just speak freely on what they think. And that's where true learning happens. And I think that in school, unfortunately, what happens sometimes is what you kind of talked about, and those things can't get brought up and talked about in an environment in which they should be able to be talked about. Like, that's why we're in physio school, and that's why you're having those conversations. But unfortunately, it doesn't work like that always. Like, I'm not saying that it's never like that, or other schools might have opportunities now where that's a little bit better. But for the most part, I think it's frowned upon in ways, or it just doesn't happen. And Level Up initiative and that opportunity has allowed students to do that. And I think that's why people become so attached to it.
Yeah, it definitely has and is becoming something we didn't necessarily expect it to. But I think that also, in hopes of maybe, some people in academia hearing this, our goal is not to be that kind of anti-establishment movement. We're not trying to come at schools or be against academia in general. We really want to work with them, and we want to eventually curate something that is a hybrid of what is there now, not taking out core curriculum, but maybe some of it that is completely unsubstantiated in evidence, and helping to restructure it in general. That would be unreal. But I think that, some winnable battles, because that kind of stuff takes time, is a little bit more the, adding in some electives where, student groups are motivated to and can kind of do the organizational part on their own and just start these conversations a little bit. My group and I have talked a ton about my favorite new term. Not really sure where I heard it, or if maybe it just came up in conversation with me, Mike, and Zach, who knows. Respectful challenge. And that goes on all levels, as far as like within yourself, amongst your colleagues and coworkers, and then, you know, governing bodies and the greater masses at large. Because I think that challenge needs to stop being this thing that somebody's attacking your being, like your, you know what I mean? No, and it's not that at all. It's the subject matter that's being called into question, and that you want to kind of arrive at something better. So I think that is another kind of sort of PSA that I want to make sure is out there about Level Up is, you know, yes, we have a sense of urgency to make some change, and we've got some fire, but you know, it is by no means it's all genuine, and it's better.
It comes from a good place, right? I think it comes from a good place, and it's for the right reasons. And I think what tends to happen when you have movements like this or challenges is that people think it's coming from a bad place, and it's not at all. And that it's okay to reevaluate and change things that you once did. Like, there's nothing wrong with that. Like, taking some things out is fine. And what I've started to realize, and I've talked with Will about this, is like, it's not that we're saying that is bad. Like, we're very grateful. Like, you're grateful for those things, because if it wasn't for those things, we wouldn't be where we are now. Like, we wouldn't have been able to get to this point. So I think people at one point I would get angry or like try to discount that, but at the same time, it's like, no, that's just what we knew at that time. And that is extremely valuable to where we are now. And I think if we can just kind of change our mindset around it, it would make it much easier for us to move forward.
What I equate it to is, like, think about surgical procedures. Like, those things are changing. It's the surgery and nutrition too, like, but specifically surgery, because that's where you're talking about an extreme of like life and death, potentially, you know, like cardiac and brain surgery. If they didn't continually change and learn from mistakes, how would we be able to do the things that we do for people with like cancer, or, you know, aneurysms, or Parkinson's, or whatever it is, like, and that never gets called into question. You know, surgeons are coming up with new techniques and better ways of doing things based on research all the time, and nobody questions, you know, the surgeons that were doing it a certain way 20 years ago, they update and they change, and nobody gets upset with them. You know what I mean? So to me, it's kind of like, why should that be any different?
Yeah.
For PT.
That's something that we've talked about a lot. Like, is the idea that it's okay to express that you disagree with something, that you disagree with, you know, how something's being done, and getting better at respectfully challenging. It is hard. You know, it's something that I think we're not entirely comfortable with, but like you've mentioned, you know, for progress and for moving the needle forward, we got to do it.
Amen.
So, Steph, we know you're big into the ACL, and we're not going to go too far down that, because I know you've talked about that on a lot of some other podcasts, and you got some cool stuff coming up. But what's new with you in terms of the ACL and what you're looking into currently with that?
Okay, so I have a new area that I want to dive into a little bit. Maybe not necessarily new, but a little bit more formally diving into. So again, this all came out of conversations with Mike Amato. Shout out, Michael. So I am noticing more and more with and even just from my own experience after ACL, that we need to be putting a little bit more weight on and looking into the psychological impact of ACL injury, and kind of, again, there's a little bit of there seems to be a recurrent theme of almost like a psychological crisis of sorts as that return to sport day comes, and through rehab. So what I've been starting to dive into, what I'm going to present at just a staff in service, I'm going to put together something for that, and also be talking a little bit about it with clinical athlete and science for sports. So I kind of, like I was telling you guys earlier, hoping to, dive into this hard, but also work smarter, not harder, in the sense of developing my own speaking skills, like we were talking about, and also something that I feel like can eventually help as far as education for some of the team athletes that I work with. But anyway, what I found thus far is that there's this mismatch between physical readiness. Like we've gotten I think a pretty fairly good handle on return to sport testing, in knowing that it shouldn't just be, the quad to hamstring ratio, and shouldn't just be a single and double leg triple hop for distance, those kinds of things. Like all of those things we know they can almost be studied for, and patient can pass all those. So we've upped the standard a little bit on that for the most part. And what I've been reading is that there's this mismatch between the physical readiness, but then either the actual percentage that return to sport, the percentage that return to higher level or previous level of sport, and their perceived readiness in doing either of those. So if basically the argument is, if all these tests show that this athlete or this person is physically ready, but then they don't return to same level, don't return to sport, and or have reservations about doing so, then what are we missing? So I think that, long story short, the most recent one that I read was talking about, they actually used, the methods was a phenomenology approach, which is basically like it's qualitative, and then they do a bunch of things statistically to help draw out themes. And some of these themes, I'll read it off really quick just so you get an idea. Hesitation and lack of confidence led to self-limiting tendencies, heightened awareness after ACL surgery. This is a biggie. Expectations and assumptions about the recovery process influenced their decision to return to sport. Coming to terms with ACL injury led to reprioritization, and that makes me sad, because basically that one was talking about how they were like, the whole, I got to hang up the shoes now, or I can't play at the same intensity after ACL. Theme 5 was athletic participation helped reinforce intrinsic personal characteristics, so there's a positive. And then having a strong support system both in and outside of rehab were key factors to building their confidence. So I think the biggest sort of full circle thing for me is, as I dive into this, is, yes, identifying the problems or whatever, but not necessarily harping on the problems, but more so diving into, okay, what can we do in rehab to reinforce confidence and make it less common for when these doubts kind of infiltrate these athletes and people's minds, because they will. It's rightfully so. They're not going to feel, in the same shape or as strong or whatever. But shifting their expectations and their mindsets at the get-go, because I think down the line that ends up altering movement patterns, performance, and essentially almost like that whole self-fulfilling prophecy as far as re-injury. So yeah, that's my next rabbit hole.
That's awesome. Like it's so obvious that those factors play a huge role, but I feel like from having discussions in the past with other people, we worry about that scope creep of, are we becoming psychologists and stuff? So I don't know, maybe you can talk about your thoughts on that.
I understand it. I understand that people are saying that, but I think that what I don't want people to misinterpret is that by quote unquote addressing these things in rehab, all I'm saying is, reassuring these athletes that they have this strength, that they have that it's normal to have these sort of reservations and whatnot, but then also making sure that we kind of intersperse some of the actual research and stats about this stuff. Like, that you don't have to think about hanging up the cleats. You don't have to think about changing your intensity, and that research shows that the reason that happens most often is not because there's a poor quad to hamstring ratio, or your single leg triple hop test is not as good on that side and you just can't seem to get it. Like, it's not because of those things. It's because you think that you should dial it down. And that's not, that's not psychology to me. That's just basically fancy reassurance. And I feel like we are in a really good place to do that because we see them often.
Yes. I think it's so important to like take advantage of that from our perspective as like physios. I think we spend a lot of time like hemming and hawing over whether it's something we should do. And I think we just have to take advantage of it before someone else does. And I think we sit, like you said, in such a great position to do that, with seeing them often, with using movement and exercise and education as a means to reinforce those things too. I think we sit in such a good position to do that. So it's cool to see that there's more research coming out to show that these things have a huge effect. It just supports our ability to take a stronghold on that position.
Absolutely.
Sweet. We got one question that we're going to ask you from Instagram since we're kind of running short on time. Yeah. So we're going to ask a question from Alex Deere. He follows us on Instagram. He's a beast. He's doing great things. His question was, how do you educate patients through questioning them rather than telling them the information specifically?
Oh, I love that. And actually, I think we probably do that more than we think we do. But I think that probably the most often that situation happens where I feel like it's utilized well is when someone is questioning doing something, some sort of activity, whether it's post-op or whether it's someone with low back pain and they want to know if they can do the Stairmaster or something like that. I think probably what's most often with back pain is their sitting position at work. And so let's say I'll give an example then, like someone with back pain and they're asking if they should stay completely upright at work all day, if they have a desk job. And oftentimes what I will come in with a little respectful challenge and say, well, would you stay in one position all day anyway? Like, even if you were sitting and watching TV, like, do you think you would be sitting in the same position all day? And most of the time people are like, no, I shift all the time. And I'll say, okay, I think maybe you should just do that. Just don't be in any one position. And people start to think, like, once they start to feel a little bit better with what we're doing in the clinic, and I'm talking about, I have a woman right now who's a little hesitant, and she was doing like suitcase deadlifts and carries because she was kind of having some one-sided pain, and I wanted to gently sort of expose the opposite side to some loading sneakily. And she's been doing all this and that, and going up the stairs were the only things bothering her. And she was asking about doing things at the gym, and I said, how do you feel with what you've been doing here? Just kind of making, I think if anything, most of the time the question, to bring it back around for you, Alex, sorry. I think most of the time I use questions to make them reflect on what they've already done without any issues.
Yeah.
Or what they're doing during the day. I think that has been the most powerful for me. And those are just a couple examples, but they very much so, they kind of get where you're coming from, and you can give them the nice little smile, like, have at it at that point.
Yeah.
And just dose.
No, I think it's a good point. Let them come to the conclusion themselves, which is more impactful than you just telling them. There you go. So we had a
great question.
Yeah, it was a great question. Thank you, Alex. We had some other questions from some jokesters, aka Hannah Moves.
Oh, that's weird.
Yeah, classic, right? So his question was, how does Zach feel living in Steph's shadow? I'm like, that's a classic Nick Hannah question.
Somehow he makes it onto all of our podcasts.
Yeah, I know. We got to stop talking about that guy, man. I'm telling you. Jeez.
It's very, very funny when we were in Toronto. Like, Zach was super excited to see Nick, and he was like, I'm gonna give him the biggest hug when I see him. And then we get there, and Nick says hi for a minute, and he's like, dude, I hope you know I just came here to say Steph. Like, what's wrong with you?
Oh my God.
So he'll appreciate the running joke. I think. I mean, I get enjoyment out of it.
Yeah. All right, Steph, we appreciate you coming on. We'll wrap it up there. Why don't you just kind of leave your information where people can find more about you and what you're doing?
Yeah, absolutely. Most often on Instagram, stephAllen.dpt. I'm also on Facebook, just Steph Allen. We are making a little bit more of an effort to do some more stuff on the Boston PT Wellness Instagram. That's just at Boston PT Wellness. Things have just been a little bit crazy. And, as always, the levelupinitiative.com and at the Level Up Initiative on Instagram are both really good resources. And shout out to the Hanna brothers for that, because Zach Hanna does all of our graphics for that, and he frickin' kills it.
Can't get away from those guys.
I know. I guess they're all right.
Yeah, they're right.
But no, thank you guys so much. I mean, I know we talked about this a couple times. I think a lot of the conversations that we have amongst ourselves need to be heard a little bit more. So you guys give us a platform to do so, and hopefully reach some people and add some value and suck a little less, right?
Exactly. Yeah. Thanks, Steph. We really appreciate it, and you're absolutely crushing it, and it motivates us to continue to keep going. So keep doing your thing. We're here for you, support you all the way through.
Hell yeah, you too, guys.